Alright, hi guys, we're going to go through just a quick Artline setup today. So you're going to need a few things. You're obviously going to need a monitor that can monitor Artline, so you need a transducer cable as well, pressure bag, 500ml bag of saline, your transducer kit, an arterial arm splint, and that's about it. Oh, and an IV mount. So let's go through the transducer kit and how we'd prime that. So just get out your transducer kit, and there's a few parts to it. Your actual line labels, which are really important, and then non-vented caps to replace the vented caps that come with it. So open up your line, roll the clamp down, and all it is just like anything, spike your 500ml saline bag. And give the chamber a little bit of a squeeze to prime that. One thing you'll notice is that when you get the line out, is that there's white vented caps on all the ports. So these need to be changed to the non-vented caps, and that way you know you also primed each of the ports as well. So what you can do is open up that roller clamp, come down to the first port where the IV mounting system is, and then turn the connection off to the patient. Open up this port there and give this a little bit of a tug, and what you can see is in real life you better see that the water, the saline, is coming through the line, and wait until that's fully primed and the water comes out that port. Then you can pop your non-vented cap on. Now you can turn off to that port and come down to the next port. Turn this one off to the patient. Give this a little pull again and watch the saline come down the giving set. Change that over to your non-vented cap once again. Now it's very clearly marked with the yellow caps that you can tell you've now primed those two ports. Turn it off to that port. Now it's all the way open to the patient, so priming to the patient's end. Give that blue tab a pull again and watch the saline come out at the end. Pop your final yellow cap on. So that is now primed and ready to be connected to the patient. It's not ready to give you an actual reading yet, but in any event, this is probably the most important part that you need to get ready for the doctor to connect once they've inserted the line. The rest, when it comes to zeroing things, you can do after. So what you want to do is grab your IV mount, pop that on the patient's IV pole, and pop your little connection into the mount there. And then what you want to do is just level this with the patient's phlebistatic access, which is the fourth intercostal space on your mid-auxiliary line. Lines up with the right atrium. So just make sure that's at the right level. Get your transducer cable from the monitor and connect that to your transducer kit. You'll see that there's a triangle marked on the cable from the kit and the cable from the monitor. Click those in. You'll hear it click. Come over to your machine and check your equipment and make sure that your arterial line is actually activated. Once you activate it, you'll see that it will come up on the monitoring screen there, ready to be used. The next thing you want to do is inflate your pressure bag to 300ml of mercury, or the green zone. Perfect. All right. Now you are ready to go. So say the Artline's just been inserted and you've just connected this to your Artline. You're probably wondering how we would zero it now. So what you would do is, this is connected to the patient's end. You would turn, you can do it from either port. You turn the kit off to the patient. You would then open up this port to gravity or atmosphere. Come over to your machine and find the button that says 0, press 0 or press and wait for it to beep. And it will then acknowledge that the 0 has been completed, 0 done. Pop that cap back on and turn it back off to the port, open to the patient. And then what you'll find is you start to get a reading up here and a waveform. You then want to confirm that that blood pressure reading is correct. So you do want to do a manual blood pressure on the patient as well. If you have any questions, please just let me know. You can pop a comment down below or just catch me on shift. Thanks.